A Waikiki Community Health Clinic says it has seen a 700% increase in patients without medical insurance because of the recession. The Waikiki Health Center is so busy, it's enclosing a former lanai and turning it into more treatment rooms. KITV4's Keoki KERR here with the exclusive story. Keoki?
And Laura, the Waikiki Health Center has also converted closets and hallways into offices and exam rooms to try to meet the needs of the crush of newly uninsured patients who are flooding its doors. Noreen Kanno goes to the Waikiki Health Center once every 2 weeks to get treatment for hepatitis C. She knows firsthand how busy the clinic is.
I would be waiting and the room would be filled with patients, and the answer back would be, oh, we don't have any open exam room.
So Waikiki Health Center is spending $150,000 converting this former lanai area into these 3 new examining rooms right off the clinic's waiting room. They'll open at the end of the week, in addition to 13 exam rooms already operating. The center's executive director says 2 years ago the clinic would see 2 to 3 new uninsured patients each day. Now the number has jumped to 21 or more new patients daily with no medical insurance.
The majority of them are people that have always been working, and all of a sudden now they find themselves, unable to pay for some of these services.
Waikiki Health Center, this is Beverly speaking.
When people call the health center, sometimes they have to wait for days or 1 week for an appointment.
And they've lost jobs. They're not able to get jobs that provide them with medical insurance, and so they're coming to us.
The Waikiki Health Center has turned the end of one hallway into an eye exam room. It's converting a former staff kitchen into its first ever pharmacy. At the end of another hallway, there's this phone booth-sized tiny office for an HIV counselor. And this former closet has been turned into the chief operating officer's office.
We're very fortunate that so many of our employees are really creative, they're innovative, they're flexible and willing to try new things.
But this patient says while things may be cramped, the staff is welcoming.
I feel like a family here. They treat you like family, not like an outsider, or, so it's comfortable. I like it here.
Now, Waikiki Health Center will be able to handle about 500 more medical appointments a month with those new treatment rooms. It's hiring more medical assistants to handle the increased patient load. The center says 90% of its patients have no medical insurance on their first visit, but the center works to find them insurance through Medicaid, Quest, and other government programs, eventually gaining insurance coverage for all but about 1/4 of its patients. Laura?